Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Midazolam. Its brand name is Versed. Now before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Midazolam works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Midazolam. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Midazolam work? Well, Midazolam is a short-acting benzodiazepine and central nervous system depressant, or CNS depressant. It reversibly interacts with GABA receptors in the central nervous system. It exhibits sedative, anxiolytic, hypnotic, and anticonvulsant properties. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used preoperatively for sedation and anxiety treatment. We may see it used for the induction of general anesthesia. It can be used for procedural sedation, as well as the treatment of status epilepticus. With respect to contraindications or reasons we would not be able to prescribe Midazolam, we would not give this medication to a patient who had a hypersensitivity to Midazolam or any other component of the formulation. Patients with acute narrow-angle glaucoma would not use this medication, as well as patients who have untreated open-angle glaucoma. Now what about dosing with Midazolam? So for procedural sedation, if the patient is less than 60 years old, the initial dose would typically be 1 to 2.5 milligrams intravenously over at least 2 minutes. There would then be an option to titrate the dose slowly in small increments to the desired level of sedation. For maintenance therapy, additional doses may be given slowly at 25% of the first dose that was used. In the treatment of status epilepticus, we may see 10 milligrams given intramuscularly in the mid-outer thigh. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Midazolam, so we'll go over some of those here now. 2% of patients may experience somnolence, and in some situations this may become excessive. 1.5% of patients may experience a headache, and hiccups may happen 3.5% of the time. Now, some more serious side effects may be agitation, which can happen up to 4% of the time, or apnea. That's all we're going to talk about today with Midazolam, or Versed. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.